Good morning. I'm Amanda Pedersen, news editor for MD+DI, and this is Medtech Unfiltered. So let me get a show of hands. How many of you feel like you're losing your mind since the pandemic brain, as it's been referred to? Anybody else? Okay, just me. Anyway, yeah, it's been pandemic brain. I think is been really real. We're just not used to being in crisis mode for this long. I'm not a psychologist. I'm not a neuroscientist, and don't have a lot of research to back this up. But my theory is that at this point in the pandemic, our lives have been changed so dramatically since the beginning of the pandemic, a little more than a year ago now, that just really basic everyday things are starting to take a lot of cognitive power, and we're starting to show signs of cognitive decline. At least I am. At least I hope that's the reason. I am about to turn 40 in a month, so I'm kind of hoping it's not age-related. I don't think 40 is when cognitive decline starts, but I don't know. So take last night, for example. I was in the middle of writing a story about World IBD Day. This is a story I've been looking forward to for a while. 2 or 3 weeks ago, I received an email about it. Hey, World IBD Day is coming up. I have a very strong personal interest in IBD. I'm an IBD patient myself. I've undergone a life-changing surgery almost 20 years ago now, commonly referred to as J-pouch surgery, where they took my entire colon out and kind of took the small bowel and sort of refashioned it into the shape of a J and then hooked me back up again. So that's kind of a really simple, dumbed down way to explain a really complicated procedure. But anyway, so I knew that IBD Day was coming up, and I put it on my calendar, and I was excited that it was going to fall on a Wednesday, because Wednesdays are when I come on camera and talk with all of you about things that are going on in Medtech. I recently was introduced to a company that's doing some really exciting innovation in the IBD space, and I'm going to tell you about that in just a little minute. But anyway, I'm writing my story last night, and I was really excited about coming on camera today and talking about IBD Day, and I've been looking forward to it for a while. And then I took a closer look at the calendar and realized that IBD Day is May 19th, not April 21st. So apparently I can't function, I can't work a calendar anymore, along with alarm clocks and other things. There's so many things that I think I've forgotten how to do during this pandemic. It's really crazy. But anyway, I figured I could either pretend like it didn't happen and talk about something completely different today, or I could just double down on my idiocy and own it and talk about IBD Day anyway, a month in advance. So that's what we're gonna do. So yeah. Oh, for those of you who don't know, I'm sorry, I use acronyms a lot. Inflammatory Bowel Disease is what IBD stands for, and it includes things like Crohn's disease and ulcerative colitis. And there's some other conditions that kind of get folded into the fold there, or are related, like it's often confused with IBS, which is irritable bowel syndrome. Similar symptoms, but not exactly the same. Not exactly the same disease from a physiological standpoint. What's going on in your bowel is different with IBS versus IBD. But anyway, millions and millions of people, I've heard everything from like 500 million to I've just heard lots of numbers, but millions and millions of people suffer from this. It affects people of all ages. I was diagnosed when I was about 18 or 19. I was trying to remember that last night. I think 18. I definitely was showing symptoms at 18. But it's one of those diseases that are really difficult to diagnose. And in my case, I felt like my gastroenterologist sort of didn't take it seriously. He said, "Oh, you're too young to be this sick. You're too young to be that sick. You can't be that sick." Well, I was young, again, 18, 19, somewhere around there, but I was that sick and continued to get worse. And so anyway, it is a disease that progresses over time, and I tried a whole bunch of different medications at the time, and unfortunately, one of the biggest challenges with ulcerative colitis and Crohn's disease is that they give you medicine that basically works on a systemic level. So if they keep increasing your doses, and at some point the side effects are too much. If they're giving you a high enough dose to be effective, then you're probably experiencing side effects that are not tolerable. And that was the case with me. So this company called Progenity, I really hope I'm saying that right, but anyway, this little small company out of San Diego, California, they are working on some really innovative capsule technology. They've got a couple different drug delivery system capsules, drug delivery pills, if you will. It's a device. It will eventually, as it goes through the regulatory process, it will be regulated as a device, much like the pill cam. If you're familiar with the pill cam, that basically kind of does like a colonoscopy. You swallow the pill, and it takes pictures and video as it goes through your system, and then that data is transferred to the clinicians, and they can try to figure out what's going on with you. So this is similar in size and form factor. They've got a diagnostic version that is basically designed to, it can sense, it has a way of knowing where it is in your GI tract. So it knows when it's going from the small bowel to the large intestine, and so on and so forth. So, and then they also have a couple different drug delivery device capsules that they're working on, and those are really unique in that they, again, have that localization technology that allows it to deliver the drug in high enough doses to be effective in the area of the bowel that it is needed, rather than just systemic medication delivery. So the theory is that you'll get better efficacy, it'll be more effective for you, and fewer side effects. It won't be, toxicity won't be as big of an issue. So it's really exciting technology, and I'm looking forward to following along with their progress and seeing how they progress from here as they go through the regulatory process. That's very early stage right now, but it is really exciting, and I ended up writing a story about it and publishing it late last night, so I'll go ahead and share the link in the comments as soon as the stream is finished. But yeah, that's it's just really cool. There's so many unmet needs in IBD, so I was really happy to see somebody, I'm really happy to see some innovation happening in this space. And I know that there's a lot of other innovation happening. We don't have time to address all of it in this broadcast, but if you know of anything, if you've heard of a company, or maybe you work for a company that's doing some really cool things in the IBD space, things that could really help patients with IBD, either in the form of diagnosis or in treatment. As long as it's, device-based. We don't really write about pharmaceuticals unless there's a device angle, but please feel free to give us a shout. We're going to be writing more about it, especially now that I know I have like a whole month to prepare for the actual World IBD Day. So there's that advantage. So do reach out if you're if you have any tips to share in that realm. With that, I'm just going to go ahead and go check my calendar and make sure that I'm, not forgetting anything else. I'm not a month ahead on anything else, or even worse, behind on something. But I really hope I'm not the only one that's experiencing this pandemic brain fog thing. It's really starting to frighten me. I mean, I joke about it, but I think it's a real thing. I really do. I'm serious. So I hope that you all have a wonderful mental fog free day, and we'll see you next week on Medtech Unfiltered.